Welcome everyone to today's webinar. My name is Michael, and in a few moments I will pass you over to Helen to discuss with you Parkinson's medications. But first, a little bit of housekeeping. This webinar is designed for people with knowledge in giving medications and is here to help further understand your role and develop your skills. If you do have any questions for Helen during the presentation, please feel free to ask using the Q&A feature. However, we'll answer them all at the end just because of a little bit of a delay between you and us. But for now, let me pass you over to Helen. Helen, please introduce yourself and let's get going.
Hi, thank you, Michael. Thank you for everyone for joining today's webinar. For those of you that don't know me, I've worked for PrimeLife for 4 years and I'm involved in everything medication, including developing new training packages, audits and email. Previously to my joining PrimeLife, I've worked for several pharmacists supporting care homes all over the country. I do think of myself as a people person, and I hope you find this webinar a useful support tool. So let's begin. Today we're going to be looking at Parkinson's medications. Medications prescribed for Parkinson's. There is currently no cure for Parkinson's, but there are many different drugs to help manage the symptoms. Medication is usually the main treatment for Parkinson's disease. The drugs work by copying the actions of dopamine, a chemical which is released in the brain. Most treatments work by increasing the amount of dopamine in the brain, acting as a substitute for dopamine by stimulating the parts of the brain where the dopamine works, and blocking the action of other enzymes that will break down the dopamine. Common medications. So the residents may be taking one of or more of these medications, and it is important to know the brand names and the generic names. Here are a few examples, and these medications are available in different forms, for example, patches, tablets, capsules, dispersible tablets. So levodopa, which is also known as cobenladopa and cocarladopa, Sinemate or Madapar. Amantadine, entrecalcitone, which is known as Contan, cocarladopa and entrecalcitone is Stalevo and Stanic. Ropinirole is known as Requip, and rotogotine, which is a patch, is also known as Neuropo. So, what is a time-critical medications? Some medications need to be given at a certain time to make sure they are safe or work effectively. Examples of these include medications that should be given before or after food, medications containing paracetamol, and we all know that we have to allow 4 hours in between the paracetamol administrations. Medications prescribed to ease mobility for people with Parkinson's disease. And today we are looking at those Parkinson's medications. So the timing of these medications is very important, and if not given at the correct time, the symptoms can worsen. These are some of the effects of not being given the medication on time every time. The resident can become anxious, agitated, even aggressive. They could have tremors or shaking. Speech difficulty, they could be trying to tell you what's wrong. How will you know? Just remember that not every communication is verbal. It's their body becoming rigid or they find it difficult to move. Again, these issues could cause violence, they could cause incontinence, and obviously that will make our residents lose their dignity. Okay, so this medication timing may not fit into the home medication round, but it's important that we give it on time every time. The correct medication. So what does it look like when we're giving the medication for Parkinson's correctly? Residents living with Parkinson's are often described as being on when their medication regime is working and their symptoms are under control. If a resident goes off, it means their symptoms are not under control and it gets harder for them to move. This could be that the medication is wearing off and symptoms become poorly controlled. Some people completely freeze. Some people can go from on to off very quickly, just like a light switch. Resident-centred care plans should show how residents with Parkinson's disease will receive their medications safely and in a way that meets their needs. Timing of medications will be based on an individual need, and you should only adjust these medications after discussing it with a specialist in managing Parkinson's disease or their doctor. Additional support. There is help out there for people and residents that have Parkinson's. The SALT team, also known as the Speech and Language team, help many residents living with Parkinson's who have trouble swallowing and problems with speech. They're able to teach and support them with speech and swallowing exercises, so it could be worth getting the SALT team involved. Diet advice, obviously always using a good diet is going to improve their overall well-being, but increasing their fluid and fibre, reducing salt and an overall healthy diet can also benefit. Physiotherapy. A physiotherapist can help relieve stiffness in muscles and make movement easier by advising on gentle exercise techniques. And this could be something that's done, on a one-to-one with a resident as well. Occupational therapy. This can identify problems with everyday life and offer support on dressing and washing. And it's most important, however, is getting their medication on time, every time. So what happens if a dose is missed? You might miss a dose of a resident's time-sensitive medication for Parkinson's disease, or if the resident refuses to take the medication. What we have to think about is why. Why is the resident refusing? Is the resident having issues with swallowing due to the disease? Do we need to seek advice on changing the form to a soluble tablet or a patch or a liquid? It is important that we address this situation promptly and speak to the GP. Or we could have missed administration due to the medication administration not being in the normal meds round. Medication administration records or MAR charts or the EMAR must show this. Staff should be able to explain what action they took by documenting the action on the reverse of the MAR chart. When we say about the medications being not at the normal time of the meds round, we normally give our meds morning, noon, tea and bedtime. With Parkinson's disease, they can be on 5 times a day or 6 times a day. We should include contacting the resident's GP and remember to document the doctor's instructions in the care plan and on the MAR charts, and inform your manager and your colleagues of this communication. Things to think about. Sometimes residents will refuse to take their medications. As we've just discussed, it could be because the medication is hard to swallow, it tastes unpleasant, or causes side effects such as loose stools or constipation. You can usually tell from the person's reaction that they dislike the taste or that the drugs cause unpleasant side effects. Contact the GP for advice and alternative forms of that medication. There are times where the person is more comfortable taking the medication in a particular setting or with the help of a certain member of staff. Think about your dignity and respect training when administrating medications. If the resident refuses a medication, we can offer the medication later, but this must be documented with the exact time on the MAR chart and does not apply to the time-critical medications. So this does not apply to our Parkinson's medications. Remember, the resident has the right to refuse, but we must discuss this. We must talk to the resident and see why they are refusing their medication. And with time-critical medications, it's really important that they get their medication, as I've said before, on time, every time. It is important to remember to document on the reverse of the MAR chart any results or outcomes if the medication is a PRN or when required medication. And what we should also be documenting on the reverse of the MAR chart is the exact time the medication was given. Do not be tempted to try and hide medication in food. Medication that is hidden in food is called covert medications, and we discussed this on a previous webinar. And this needs to be approved and have written consent in place. This should be documented in the care plan and documented on the MAR chart. Think about your MCA and dose training when administrating medications. Does the person have capacity to refuse to take their medication? If they refuse again, try again later. Remember to document and report all non-administered medications and inform your manager. If the medication is refused throughout the day, talk calmly to the resident, explaining the importance of taking the medication and how it will help them before documenting it as refused. Remember, documenting all non-administered medications on the MAR chart is just as important as documenting when a medication has been administered. This information could be important later. Always remember to wash your hands before and after administrating any medications and use the appropriate PPE. Remember to clean the medication trolley before and after each medication round and replenish the Medipots, giving spoons and syringes. Think about your infection control training when you're administrating medication. Medication side effects. This could be feeling sick or dizzy, trouble sleeping, jerky movements, hallucinations. Remember to monitor the resident for any changes or reactions that may be caused by the medication and report your concerns to your manager. Always check the patient information leaflet, the PIL, in the medication books, or the BNF book or EMC online for all side effects and medication advice. And remember, if a resident has any vitamins or supplements brought in by relatives, it's important that we check that these are suitable to be given with the pharmacist and with the doctor. Please document these on the MAR chart and inform your manager. And do we have any other questions, Dave, today?
Well, my name is Michael, but otherwise...
Michael?
Yeah, we do have a couple. So first one, you mentioned about recording medications at a certain time, and someone has asked if can I just record them being taken in the morning, noon or evening, or should I record the actual times?
Yeah, they need to be recording the actual times, either on the MAR chart or on the back of the MAR chart. This is really important because what we found is that if the time is not documented correctly, then sometimes we're giving too long a period of time and the resident does start to what we call freeze, and then or start getting tremors or whatever, you know, things like that. So the time is critical. That's why it's called a time critical. We can't just sign that we've given it morning, noon, tea in bed. We have to document the exact time.
Yeah, that makes perfect sense.
Also, sorry, Michael, just to add to that, normally when the doctor prescribes Parkinson's medication, it has been discussed at the times that it's best given. So if the doctor's saying that it should be given at 7, 11, 2, etc., then we must give it at 7, 11 and 2. We can't just say, oh, we'll give it at 8 o'clock because that's when our meds round starts. Okay, so if the doctor's got it on there, we have to give it at that time.
Okay, so either look at what the doctor's saying or use the recommended timing and make sure you're spreading them out correctly.
Yes, absolutely.
Question just come through. Is there a time limit between Parkinson's time critical medication and regular prescribed medications, so not to counteract?
So is there timing in between Parkinson's and other medications? Is that what I heard?
Yeah.
Again, it would depend on the medication. Some people with Parkinson's can have several types of Parkinson's medication as part of their medication regime. Again, they would have to be careful. You would need to check all the interactions, allergies, etc. before administrating that medication. The time allowed, again, Parkinson's medications don't normally fall in line with probably the rest of the medications that's due to be given at that day. So yeah, again, it would be on an individual basis that we would look at that.
So it could be a case that a resident has a Parkinson's medication they have to take at 7 o'clock, and then a medication for another thing they need to take at around 8 o'clock. So you'd have to go back and forth, make sure you're checking their plan, make sure you're checking the medications they've got.
Absolutely. And as I said before, you know, normally Parkinson's medications don't normally fall in the normal meds round. And it's important that we either set an alarm on our clocks, or we do something in the home. On the email system, we can document on the homepage that this person has their medications at these set times. I know some of our homes set alarms to go and give the residents their Parkinson's meds. It is really, really important that we give that medication on time, every time, as the doctor prescribed.
Perfect. And honestly, a question just came through about should you set an alarm? So I think you've just answered that for them as well. So thank you very much. Lastly, another question we've had come through is this mainly an older person condition, or can it be seen in younger residents as well?
It can be seen in younger residents, yes. And I think if we look back to Michael J. Fox, I think he was about 30 when he started with the symptoms of Parkinson's. There's been other, you know, famous people that have got this disease. And as I said before, there's no cure to it yet. But there are medications, and getting the medication regime just right really helps support them in the long term.
So it is a condition that you can live with as long as you control the medication properly? Yes,
definitely. Because if they're not giving the medication on time, as I said before, they can go rigid. They can start with tremors. But if you go rigid and you can't move, that could lead to other things like incontinence, lack of dignity, and you know, we could go on and on about this, but the main thing is getting that medication in to stop the resident from freezing. And normally the doctor and the resident have gone through a whole trial of medications to get it just right, to get those timings just right for them. So we can't just say, oh, you know what, we'll give it at 8 o'clock along with the other meds rounds. And I have seen in some care homes where staff didn't realise the importance of giving it on time, and the resident has actually frozen or gone rigid, and then that's affected their speech, so they're unable to tell us that they need their medication. They're unable to walk or move. They're trying to get to the toilet. They become incontinent. You know, the dignity and respect is all there, and it all comes down to, you know, ensuring that their medication is given on time.
Yeah. Well, thank you, Helen. I think that's all the questions we've had so far today. So I'd like to thank everyone today for taking part. Helen, if they do have any other questions and would like to reach you, how can they do so?
Hi everyone, thank you for watching again today. So if you need any advice or you have any questions, just reach out to me. I can be contacted on helenberridge@prime-life.co.uk or 07917045483. Okay, thank you all.
And thank you all for watching. Thank you, Helen, for your time. We'll see you again in 2 weeks. Goodbye now.
Thanks, Dave.